Hi, my name is Olivia Shasho. I'm going to be doing the validation for Piggy Back. So always, when we're doing a piggyback, that means we're giving a medication through the IV, essentially using the main IV. You always want to check physician's orders and check your medication with the physician's orders and the MAR. It's really important to do that. So in addition to that, we're going to be doing our steps. We're going to be checking the orders, washing our hands. We're going to gather our equipment, which is the Piggy Back, the IV tubing, and some labels for that, as well as a alcohol swab. So we will also identify the patient using the wristband and asking them name and date of birth. I'm going to introduce myself to the patient, provide privacy, and explain the procedure. So I'll be explaining that we're just going to be giving medication through the IV at this point. We have our drip going, so I'm going to still assess the IV site before we add another. It does not look red or irritated. Patient does not have any complaints about it after I asked. So we're going to continue on. Another important thing with your medication, you always want to check expiration date. Looks like we don't have an expiration until April 2019, so we're good. Also check for any cloudiness, particles, if there aren't supposed to be any. That's important. So we're going to open up our tubing. And also at this point, we're going to want to label the tube and the Piggy Back bag. So we have a smaller label for the tubing, a larger one for the IV bag, and those are going to have the name, date, and time that they were started. So before I get that going, I'm going to use this hook to lower the main IV bag. By lowering it and putting this one at a higher point in space, this is going to be the one that's going through, even though this will not be clamped. Okay, and for this, I am going to clamp it before I spike my bag. Otherwise, the medication will just pour out, and we've lost a bunch of medication. So, I'm going to start by carefully removing the cap. We do not want to touch that. And we're going to carefully remove the cap on the spike as well, being careful not to touch the spike because it's sterile. And also being careful not to spike the IV bag by accident and poke it. So we're good. We have this clamped. We can flip it over and we're good to continue. So we're going to fill up the drip chamber about halfway. I have that. And I'm going to use our basin here. I have the main IV drip in here because normally it would be in the patient already, but we don't want to actually put the IV in a mannequin. So I'm going to remove this carefully, not touching it. I'm putting it cap up because it must remain sterile. Keeping it above my waist. And I'm just going to prime the tube. So slowly let the medication out. You want to make sure no air bubbles. That's the whole point of priming it, to remove air. Okay, we are good so far. Okay, so we got a couple drops, and I'm looking at the tubing. It looks bubble free. So I'm going to take that, put it back on while we continue onward. So I'm going to take my alcohol swab and clean the port for about 15 seconds. 15 seconds later. Then we're going to remove the cap and carefully place it onto the alcohol port, which is now clean. Okay, so now we're all connected. we're gonna pretend this isn't the patient. So from here, I can open this up. This is pretty much like the on-off button for this. That's like a way to think about it. And you're gonna be adjusting all drip factors from the main IV tubing from here out. So, for this one, the doctor's order says we're gonna do 60 drops per minute. Oh, where are we? And so I'm gonna be doing that here, using my watch. Okay, so because we're doing 60 drops per minute, okay, so we have our drops per minute, and so we would be able to know roughly how long it's going to take for that medication to completely infuse into the patient. And what would happen is, you know, make sure the patient feels okay. Bed at the lowest height, handrails up or side rails up, call bell. We would then document I's and O's and come back once the medication is due to be finished. We would then switch them back and make sure we adjust the drops per minute back to 40 drops per minute, which was what the main IV was at. So this would be lower or removed, and this one would be higher, and we would adjust the drops, okay? But otherwise, yeah, I'd wash my hands, make sure the patient is safe, as I described earlier, and we're all set. Thank you.